Good day, everyone. I'm Dr. Danelda Gowan, and it is my pleasure on behalf of the INCAM Research Network's Member Resources Committee to welcome you to this webinar, the first in this series of shared learning experiences led by INCAM members for INCAM members. And as past chair of INCAM, I, along with our current chair, Dr. Amanda Baskell, and our past chair, Dr. Kieran Cooley, are so pleased to see these exciting new developments in the network's activities that will help to nourish our community and help the network to serve its purpose and its goals. And what are they? INCAM exists to serve as a collaborative and interdisciplinary research network in Canada, providing infrastructure to support research on TCAM. The goals are to enhance communication among individuals with the common interest of integrative health research, to promote excellence in research by providing forums for both learning necessary skills and for the presentation of research. And lastly, to collaborate with professional organizations and other societies, including international organizations with similar goals. So it's now my honor to introduce our presenter today. Dr. Maryam Yavari is a healthcare practitioner with a background in traditional humoral medicine and extensive involvement in clinical research. She obtained her medical degree from Isfahan University of Medical Sciences, a Ph.D. from Shahid Beheshti University of Medical Sciences, and a naturopathic medicine doctorate from the Canadian College of Naturopathic Medicine. She's also completed a 2-year clinical residency in naturopathic medicine, and her contributions to clinical research are evident from her numerous peer-reviewed publications, scientific books, awards, and grants. She's an academic faculty member of CCNM and has lectured at the University of Toronto. She also serves as a board member of the Communications Committee of the International Society for Complementary Medicine Research, ISCMR, and as the co-chair of the North American Primary Care Research Group. Maryam has a passion for integrating complementary medicine and her past clinical experiences to provide evidence-based, personalized, holistic, patient-centered care. So thank you all for joining, and thank you very much, Dr. Yavari. The floor is yours.
Thanks so much for having me here, Dr. Gowan, and I'm very pleased to present my recent project on hot and cold theory, the path towards personalized medicine here for you. So I want to start by sharing my screen. And okay, then. So I'm using the slides from the U of T course on human biology course. I will start talking about traditional humoral medicine and the concept of hot and cold theory in humoral medicine. But the concept of hot and cold is something that we have in other traditional medicines as well. And then I will explain about the project that we had. So I know that like most of you are working in the field of complementary and traditional medicine, but I know that some people then don't know much about humoral medicine and they are not very familiar with the concept of hot and cold and temperament. So I decided to explain a little bit about these basics here. So starting from traditional humoral medicine. It is also known as Persian medicine, traditional Iranian medicine, Mizaj tib, Arabic medicine, Islamic medicine, Unani medicine. It is also similar to traditional European medicine, and these are not exactly the same, but the root is common, and there are minor differences between these traditional medicines, but mostly they are the same thing. They are very close. So this is a very old system of medicine, resulted from thousands of years of history and many years of experience and efforts that was made by great scientists in a vast geographic region. So based on the available evidence that we have, the origin of this school of medicine was ancient Persia and Greece. That's why it is named as Persian medicine or Unani medicine. Unani means Greek. And then it was further developed. So like we have Hippocrates, for example, who pioneered the idea of having humors and individual differences. And we have Galen that completed this theory with physiological commentaries. And then scientists from different parts of the world, like in University of Jondishapur in the old Persia, like we have Avestina, we have Razi, and different scientists, they developed this school of medicine further. So now it is practiced in some Middle Eastern countries such as Iran, India, Pakistan, and some Arab countries as well. And there are some universities, actually, it is taught in universities as a university major. And also there are some research centers working on principles of Unani medicine or humoral medicine. So let's have a quick review on the main principles of humoral medicine here. We start with the concept of elements. Unani medicine or humoral medicine scholars, they believe that all living and non-living beings, including humans, they are consisted of primary particles that are called elements: fire, earth, air, and water. So you can see we have 4 elements. So they named fire element fire because the features of this element was close to the feature of actual fire in the nature, but it doesn't necessarily mean that it is from the actual fire in the nature. So just they named it because it was close to the fire in terms of the properties of this element. It releases heat, is in motion, is a source of energy, expands, dries up humidity. So qualities of this element, you can guess that it is hot and dry. The same, we have different qualities for other elements. We have earth, air, and water with different qualities. Another concept is that they believe that the body consists of 4 vital fluids that are called humors. So we have black bile, yellow bile, blood, and phlegm. These are the 4 vital fluids or humors. So in each of these humors, one of the elements is dominant. So for example, when we talk about yellow bile, we have an element of fire that is dominant in yellow bile. So it means that yellow bile is again dry and hot in terms of qualities. We talked about elements and we talked about the humors. When the humors are combined, they form a unique balanced state for each individual. And this unique balanced state is called mizaj or temperament, or sometimes it is named nature. This unique balanced state is different from one person to another. So when we see a patient, we can say, what is this unique balanced state for them? So you can see here, this is a 16th century illustration of the 4 humors. You can see here that we have the concept of temperament or the balanced state for human here in this illustration. And you can see here, we have, here you can see that we have the balance, like the point here shows the full balance. We have one axis here that you can see on this side, it is more hot. And we have on the other side, cold. So this is the hot and cold axis. This is the quality of hot and cold here. And we have another axis here that can be considered as wet and dry. So everyone is somewhere in between in this illustration. So let's imagine if someone is somewhere near the center, they have a balanced state. So they don't have like excess amount of one of the qualities or one of the humors. They are not very hot, very cold, very wet, or very dry. However, if someone is, for example, let's say in this area, they have different temperaments. So if someone is here in this area, they have hot and wet temperament. So the balanced state of their body is hot and wet. And of course, it is different for different individuals within this area. So if someone is here, they are very hot, but a little bit wet. But if someone is here, they are very wet, but a little bit hot, right? So it is very personalized, and we have different temperaments here. This area is area of healthy temperament, so we can have this balanced state still in the healthy area. They are doing well. All the physiological functions are great in the healthy area. However, if someone deviates further from the center to this area, we will have this area of distemperament. We call it distemperament, meaning that it is out of balance. So if someone is here, for example, they have hot and wet distemperament, meaning that it is out of balance. And what we see is they show signs and symptoms of disorders here. So the physiological functions are not at their optimal state anymore when we are deviating further from the center and we have extreme qualities in the body. So this is just the quick, I wanted to explain this concept for you here. And then we have different personalities and personality traits based on these different temperaments. There's no time to explain about them, but in each of these areas that I mentioned, we have healthy personality traits, and they are also prone to have personality disorders if we enter the distemperament area. So when we talk about the idea of temperament, there are some indices that help us to diagnose temperament status for a person that we are seeing. So when we have a patient in our clinic, a humoral medicine practitioner, as the first step, will start with identifying their temperament. There are indices that can help to identify the temperament: obesity, thinness, skin color, hair condition, physics, touch of the skin, functions of the body, characteristics of waste matters, sleep and wakefulness, impressibility from hotness, coldness, dryness, and wetness. These are examples of, and like psychic functions, these are examples of the criteria that can help us to determine the state of temperament for a patient that we are seeing. And this is the first step. We want to know what is their equilibrium, what is their balanced state. And from there, we start gathering more information about factors that can affect temperament. Age, gender, seasons, region, climate, what they eat, what they drink, the pattern of their sleep, body movement, physical activity, mental state, retention of healthy matters. These are the things that can affect temperament. So as the next step, we work on gathering this information and determining the state of temperament for each individual. Also knowing the factors that can affect temperament help us to know that first of all, what are the changes that the person is predisposed to have? So, for example, if based on the pattern of sleep and wakefulness, because these are the things that can affect temperament. So, for example, if someone's job is in a way that they cannot sleep during nighttime, we know that how this factor can affect temperament and how it can move the balanced state of the body and shift it to a different place. And based on that, we can say that what are the risks of disorders based on the lifestyle factors that they have, based on the shift that they are predisposed to have in terms of their temperament. Another thing that is very helpful here is that in general, the main treatment principle is to rebalance the temperament to the balanced state, not necessarily the absolute balanced state, but in the at least in the healthy area of the temperaments that I showed you. And knowing the factors that can affect the temperament can help us to modify the lifestyle and other factors that are adjustable. And this helps the patient to rebalance their temperament. So the good news here is that recently we do have some diagnostic tools to measure the temperament. In the past, it was something that the practitioners were doing, like each practitioner was doing like their own assessment, and it was different from one practitioner to another one. Now we do have some standard diagnostic tools. We do have standard questionnaires in different fields that can help us to have a score, have a like quantitative measurement of the mesage state and the temperament state. And it helps a lot in terms of, especially in terms of research, because we do have a valid tool now and we are able to compare it, and we are able to talk about it with a valid measurement. We also, so what I talked about was the concept of temperament as a general balanced state of the body. We do have the concept of temperament for different organs in the body. So brain, liver, stomach, uterus, heart, they all have their own temperament. And we do have some ongoing research on developing valid tools to measure and assess the temperament of these organs too. So this is a good news. And we do have something called distemperament. As I explained, when the temperament is out of balance, when we have extreme qualities of, for example, hotness or like wetness, we go to the area of distemperament, and at this point, the physiological functions of the body are not optimal anymore, and we see signs and symptoms of disorders. So this temperament of dominance of yellow bile, the humor of yellow bile, blood, phlegm, or black bile. And with each of these temperaments, we do have symptoms and signs, and patients at these areas are predisposed to specific illnesses. So it is very helpful to determine the temperament and distemperament of the patient. Here, this is a simple diagram about what we talked about, the temperate area, the balanced area, the healthy cold bed, healthy hot bed, hot, dry, and cold, dry, and then cold, wet, and hot and dry. So simply we have 9 different areas of temperament, considering these areas of just simple qualities like cold, wet, hot, and dry, and temperate, and the 4 areas of combined qualities that I mentioned. And then we have this temperament, which is like, for example, when we have hot and wet this temperament, we have the dominance of the humor of blood, which is named blood, but it is not exactly the same thing as blood that we have. So they were naming these qualities by yellow bile, for example, black bile or phlegm, but yellow bile is not necessarily the bile that we have from the gallbladder. So the same for temperament criteria. We do have criteria to diagnose this temperament. So we do have criteria of symptoms and signs that show the dominance of, for example, yellow bile when we have hot and dry this temperament. So for example, you can see like change in the urine, you can see change in the digestive tract, heart rate, thirst, mucosa, tongue, and like different signs and symptoms here. The same thing that we have for temperament of the body, the balanced state of the body, we do have it for foods. But here it is more called as nature. So nature of foods are different. So different foods, they may have different natures, hot, cold, dry, or wet. And this is a very important area that it lets us to do interventions and to rebalance the temperament of a patient. It helps us to use some types of foods as medicine in humoral medicine based on their nature. And usually in a treatment approach, we choose foods that have the opposite nature of the disorder if we are in the imbalanced area, to bring back everything to the balanced, healthy area. So there are some criteria to determine the food's nature based on experiment, food's function in the body, quality that they induce in the body, sensible criteria like color and taste. So for example, here you can see in terms of taste, we have, for example, sour taste that we see in vinegar, for example, and it represents a nature of coldness. So it is one of the criteria that can help us to know about the nature of the food. But there are, we do have textbooks in humoral medicine, all textbooks that they classify all types of foods and herbs, and they classify their natures and even the degree of the qualities. So we do have different degrees for qualities. So for example, we may say something is cold in the 1st degree or hot in the 3rd degree. So there are like more quantitative measures in terms of the nature of foods. But this is a very valuable tool that helps us in terms of management of nutritional habits and lifestyle and treating the patients. So our treatments in humoral medicine include lifestyle modifications, medicines, physical modalities, and surgery. And we do use the concept of temperament and misaj when we want to address the health concerns, both in terms of prevention and also in terms of treatment. So to sum up, we talked about the concept of temperament in humoral medicine, one of the most important concepts that we have, one of the fundamental concepts. So it represents the individual differences that we have in phenotypical, physiological, spiritual, psychological functions of the body. And there are specific lifestyle recommendations based on temperament that can promote health and can can prevent disease. What we have is we see patients based on this balance state that we have, and each person or each patient, they have their own balance state. The treatment needs to be based on the balance state and the temperament or the distemperament. So if we have two patients coming, for example, with headache, we assess the headache in terms of the qualities. It can be hot and dry distemperament, or the headache can be because of cold and wet distemperament. And the treatment that we recommend to suppress pain for these two patients are totally different. So you can see that we have a personalized approach in terms of our treatment and in terms of our intervention for patients for prevention and treatment in humoral medicine. So how we can integrate this concept with conventional medicine is something that is not easy to do, because when we talk about humoral medicine, it is a totally different paradigm with the conventional medicine. There's not, like, it is not something easy to be merged into the conventional medicine. It's not like, for example, botanical medicine that can be used as an alternative, or like something that complements the chemical medicines that we have in conventional medicine. So when I was studying Persian medicine, and when I was doing research as a Ph.D. candidate in humoral medicine, I had always this in my mind that, you know, I was a medical doctor. I was seeing patients as a medical doctor. Adding this humoral medical approach to my practice, and then it was very confusing, and this integration was not easy at all. But I was seeing patients that they are having improvement, and we are seeing that, like, with this temperament approach, we are seeing a very good result. And there, you can see that there are some even clinical trials and case studies showing that, yes, this concept is working. Later, I got familiar with other traditional medicines. So traditional Chinese medicine, Ayurveda, Indian medicine. I had some colleagues from Europe, traditional European medicine. And soon I realized that in different traditional medicines, we do have the same concept of balance state in the body. They may not call it mizaj, but this is the same concept. So we do have it in different traditional medicines, and they are seeing patients and they are treating patients based on this theory. So it was the start of this idea of working on this theory and this fundamental theory that we have in different traditional medicines. And as a medical doctor who was working with in a medical school with different medical, with professors from different medical fields, it was very important for me to translate this to the modern scientific language that we have, to be able to provide that to the medical community. So we started this project, and I started working on this project as a book. I was the editor of this book, and I invited research scholars and academic scholars from different countries who had a background in these traditional medicines. So I invited Dr. Kehanian, who was a scholar in TCM, Dr. Tansas and her team to work on Persian medicine, Dr. Rastogi and Dr. Singh to work on Ayurveda, and Dr. Vasquez to work on the Latin American and Caribbean medicine, to explain this theory and the concept of this theory that we have in traditional medicines. So integrative medicine, a bridge to personalized medicine. So let's have a quick review on this part, that how the concept that I mentioned, the concept of temperament and hot and cold, can be integrated to the personalized medicine and how it can help us in our today's medicine. So these are all parts of traditional medicine, which you know that is also known as indigenous or folk medicine. We have a growth in the number of member states of World Health Organization that they do have a national policy in traditional and complementary medicine. And you can see that a lot of countries, they are actually using traditional and complementary medicine. And this number is increasing. In different parts of the world, we have different regulations. So for example, here in Ontario, we have 4 regulated CAM practices. We have chiropractors, naturopaths, homeopaths, and traditional Chinese medicine practitioners. So we do have different regulations for these professions. And we do have an increased number of practitioners working in the CAM field. But the traditional medicine, integrative medicine, is often labeled as pseudoscience, especially in our academic centers. And this is something that takes away the opportunity for scientists and for researchers to have an open-minded scientific approach to discover more about these theories. So some people, they argue that our today's medicine is the result of a gradual evolution of the old methods that we have. So the useful old treatments that we had in the past, they are already included in our today's medicine. The invalid ones, they have been phased out of our current science. So why we are then going back and we are talking about those old methods again? So when I was talking about the elements for you, when I was talking about fire, for example, the element of fire, and then making the vital fluid of yellow bile and having the qualities of dry and hot, do you think that this is something that I can talk about with a specialist, with a medical practitioner today? Do you think it makes sense? So you may talk if you want. So these are concepts that, yeah, it depends on the individual practitioner, yes, but the general concept of having 4 elements and the body consists of these 4 elements, you know, it's very hard to talk about these things with our medical community today. So this is one of the reasons that it is labeled as pseudoscience. So what happened, we believe that what happened was that we, after the humoral medicine era, we had an abrupt shift in the paradigm of medicine at the time of Paracelsus. So he pioneered this new chemistry-based approach in medicine, and then they stopped using the concept of humors. But we believe that it was not a gradual evolution, and it was a shift. And in this shift, a valuable treasure of knowledge was left behind. So let's, I know we don't have time to talk about pseudoscience, but this is something that it is important to know about criteria of pseudoscience and how and why complementary medicine is or is not part of pseudoscience. But do we have any evidence for traditional medicine concepts, especially for the concept of hot and cold or temperament? So we do have some evidence, but the number of evidence that we have is limited. So why the number of evidence is limited? And yes, communicating concepts of health and illness is challenging and has been from historical to present day. Yes, of course. Do we have any evidence? So why do we have, like, why the evidence that we have, they are limited and they are weak? There are some reasons for that. There are some complications regarding the research in this field. So first of all, it doesn't look scientific. So our ancestors, they didn't have access to our today's knowledge of anatomy, physiology. They didn't have our today's research methodology. They didn't know this, and they were not able to explain their observational findings. So although they were great observers, they were gathering this information, they were doing very careful observations. When they wanted to explain the observations, they didn't have any valid information, except they were using the philosophy or spirituality or, you know, the reasoning logic of that their own time, which doesn't make sense for us today. When we look at the textbooks of traditional medicine, we see these valid observations that are covered with these illogical or old reasonings that doesn't make sense. This is the main reason why scientists, they don't like to work on these concepts, and these concepts are untouched by today's science, because, you know, the reasoning around that is so strange for us today. And I have to add that not all the concepts in traditional medicine are valid. So some of the concepts are phased out, some of them are not working, and not all of them are valid and reasonable. But we do have some valid concepts and perceptions that they are valuable enough to work on and to do research on them. So yeah, this is the EBM model, and you see that, like, if you want to talk about temperament, the quality of evidence is usually at the base of the pyramid here, like it is low. So we don't have enough research funding in this field, and on the other hand, the EBM model does not well fit the concept of temperament and the whole system research either. So but going back to the concept of temperament, that I'm calling it here hot and cold theory, this concept is, as I mentioned, a fundamental concept in different traditional medicines. So we talked about humoral medicine, and this concept is part of, like, one of the main concepts of humoral medicine. In traditional Chinese medicine, we have the concept of the theory of yin and yang. So as you know, yin is material in nature that we have. It is more like a stable. And anything with the same condition of stability, lack of movement, it pertains to yin. So when we talk about, for example, earth, water, when we talk about sleep, about blood, these are more like stable, and they are yin. But yang is about movement and activity and driving force and facilitating the movement. So it is more hot in terms of quality. When we see a patient with a concern, for example, increased heart rate, it can be because of increase in yang, when the patient is, for example, consuming stimulants, for example, caffeine or something. So it can be because it is hot, it can increase the movement. It can be because of yin deficiency. For example, the patient is overworking, they are not sleeping, it can present with like excess heat because we don't have enough yin to cover the heat. So we do have this concept of hot and cold in traditional Chinese medicine. And the symptoms, for example, when we talk about symptoms of flushing or anxiety or thirst or dark urine or constipation in TCM, these are the concepts, these are the symptoms that are that show us the presence of heat in the body. Or for example, when we have kidney yang deficiency and we have coldness in our extremities, the skin feels cold, or we have accumulation of damp in the body and swelling, it is more of a like cold and wet syndrome. So we do have the concept of hot and cold in TCM. The same for Ayurveda, the traditional medicine of India. They believe in the existence of 3 elemental substances, the doshas, so Vata, Pitta, and Kapha. And the balance of these doshas are important in health. The imbalance that can cause the imbalance in these doshas that can result in disease. And among these doshas, we have Vata and Kapha that are considered to have cold property, and Pitta is hot in terms of quality. So a disease by Vata and Kapha is treated by exposure to heat, either externally or internally, with medicines that they have hot nature. And the same for like when we have hot disorders from Pitta, the treatment is with cold exposure. So hot and cold, or Ashna and Sheet, they are 2 fundamental precepts of Ayurveda medicine as well. We do have the same concept here in Ayurveda. We do have this concept in Korean medicine, Japanese medicine, European traditional medicine. Also here in Latin American and Caribbean medicine, you can see that it originates from humoral medicine, but they do believe in having categories of hot, cold, dry, wet, blood and bile, and fire and wind. So the number of elements and the number of humors are different here, but they do believe in the role of hot and cold in diseases and in terms of treatment and prevention. The first part of my work was that I gathered this group of people to explain this concept based on different traditional medicines in a language that is understandable for the medical community and healthcare community today. And for some of these traditional medicines, such as Latin American medicine, we actually didn't have any article or anything available in English language. So it was one of its first own kind articles or scientific publications to gather all the information about these theories. For the second part of project, I invited scholars from different fields, scientific fields, to assess the available evidence that we do have today about the concept of temperament and the balance state, hot and cold. So I had a group of scholars from Tehran University, Dr. Bahram Sultani and Dr. Rahimi, who worked on the pharmacology evidences. I had Dr. Karimi and his colleagues working on the physiology. Farideh Bahari worked on systems biology, and I had Simone Ormsby worked on evidence in nutritional science that we have today. So they gathered the available evidence that we do have today for the concept of hot and cold, and you can see some of these articles and references here. So for example, you can see here about the hot nature of different foods and medicines. We have, for example, cinnamon, significant effect on body weight, waist circumference, body mass index, body fat mass. direct and garlic with direct thermogenic effect, with increase in norepinephrine. These are our examples of our hot nature herbs. We do have, for example, ginger, again, with showing thermogenic effect, increasing oxygen consumption in animal studies. Even some case reports of thyrotoxicosis. These are herbs with hot nature. Again, like increasing energy expenditure, exercise oxygen uptake, with pepper, with cumin and fenugreek, the effects of these herbs on blood sugar and weight. There are some examples of herbs with cold nature, such as cannabis, lettuce, and the same as we expect with the herb with cold nature in terms of shifting the temperament and balance state. They can help with sleep. They can cause hypothermia. They can cause bradypnea. They can reduce the blood pressure. They can cause dizziness, lethargy. Anti-inflammatory effect for herbs with cold and wet nature, soothing effect on inflamed tissues. And you can see this is a very good article about relationship between the compounds of plants and their major and their temperament. So, for example, plants with phenolic compounds as their major constituent, they are hot and dry temperaments, except, for example, those with tannins that are cold and dry temperament, or, for example, those with essential oil are hot and dry temperament, except those with alcoholic structure, they have cold and dry temperament, or alkaloid plants containing plants, they are dry. Again, like we have some properties of different foods with hot and cold nature, and the differences that they can cause in terms of reducing energy expenditure, for example, or increasing metabolism, for example. The effects of these herbs on metabolism, glycolysis, mitochondrial respiration, fatty acid oxidation in different studies are listed here. Differences in calories and sugar, fat, and alcohol content is another proposed hypothesis for in terms of differences of foods with hot and cold nature. Oxidation potential of compounds may be different in plants with cold and hot nature. Also, like the inflammatory production of pro-inflammatory effects can be different. So this is again another study showing that the hot and cold nature foods, they can cause change in like systolic blood pressure, diastolic blood pressure, heart rate, based on the nature. So more on the hot natured foods, they can increase, for example, heart rates compared to the cold natured foods. This is another study showing the endocrine effects of diets rich in different seeds from cold and hot nature. So for example, in the cooling seeds group, VMA, vanillin mandelic acid, was reduced because of increased parasympathetic activity response. Or, for example, in the heating category, the free triiodotyrosine, the T3 or T4, and VMA, they had increase in the hot group. So, which can cause increase in metabolic rate and thermogenic effects. So, there are other possible mechanisms for cooling and warming foods and their effects on physiological functions of the body. So, for example, sympathetic tone, parasympathetic tone, blood pressure, heart rate. In terms of immunity, so for example, norepinephrine to cortisol and norepinephrine to epinephrine ratio was significantly higher in people who had hot temperament compared to the cold temperament group, based on a study done by Shahid et al. We do have, like, one of the disorders that has been studied in terms of with regard to the temperament concept is rheumatoid arthritis, especially in TCM. So they are categorizing the RA patients to hot RA and cold RA, and then they are assessing based on the symptoms that they have. So these are the group of patients that they are all labeled as one disorder RA. But we have these subclasses of hot and cold based on the TCM, based on intake and physical exam. And then there are several research in terms of differences of physiological parameters in these two groups, hot and cold RA. And also, interestingly, the differences in the response to treatment, and some suggestions that some treatments are working for one group but not for the other one. So here you can see, for example, pathways that are related to cold RA patients are listed here, for example, in terms of changing the TNF-alpha, interferons, T-cell proliferation. We have different muscle breakdown, fatigue levels of fat and protein metabolism is different. So there are differences between these two groups of hot and cold RA, and expression of different genes. So for example, these 4 genes are higher in terms of expression in the cold RA group, included in a small G protein signaling pathway. So other differences in terms of physiology are listed here. In terms of thyroid hormone function, this article here you can see is talking about the concept of Zheng, which is a close concept to the concept of temperament in the context of neuroendocrine immune network. And then here this diagram summarizes what we have in systems biology for hot and cold temperament. So you can see, for example, the activation of, for example, HPA axis is lower in the cold temperament. You can see some genes and proteins that metabolize, so at different levels, we have overexpression or underexpression of a group of genes in those with hot temperament compared to cold temperament. So we do have research in this field, and we do have differences that can explain this concept of temperament and this approach that we have in humoral medicine or other traditional medicines to see patients. There are limitations to do research in this field because, as I mentioned, some of these traditional medicines are not available. The textbooks are not available in English. We don't have access to them. It cannot explain all the medical conditions. And it looks like at the level that I explained the theory, it is a very simple theory. So it cannot explain the complexity that we have in the body system, and we need to add more layers to that. And of course, there are more layers to that in traditional medicine, such as the temperament of organs that I didn't include here. But to make it easier to integrate, I think we can start with this first level of the general systemic temperament and balance state of the body. And this was an example of a fundamental concept that we have in traditional medicine, and it has the potential to be integrated to the mainstream medicine. It has been used as a complementary medicine alongside with the mainstream medicine. It has been used in some occasions as alternative medicine for patients who do not want to seek conventional medical therapies. But it has the potential to be used as integrative medicine method as well. Interestingly, when we talk about holistic medicine, we see that when we talk about the concept of temperament, we are observing everything, the physical symptoms, mental symptoms, emotional signs of the patient, impact of social, environmental factors on health and disease. And this is such an approach represents a holistic view of health, something that we are trying to move our today's medical system toward this approach, the holistic approach, because you know that with the reductionist approach that we have in our today's medicine, there's there's the need to have this comprehension of the big picture. And there are efforts in terms of systems approach to bring this back to medicine. So what we have in traditional medicine is it actually is a holistic system of medicine, because it this theory dates back to the time that we didn't have the reductionist point of approach yet. So yeah, so this is a holistic approach to medicine. It is also a personalized approach to medicine. So at the time of Hippocrates, as I mentioned, he pioneered this idea of humors and these personalized, balanced state of the body. Then it was changed to the chemistry-based approach of medicine. And now we are going back with genomics and genomic science. We are going back to the personalized medicine again. So what we have, the information that we have from personalized medicine is actually helping us, from genomics is actually helping us to make the treatments more individualized to the patients. But I do think that adding the concept of temperament can help us to make the treatments more personalized, as it was shown in some research that I mentioned. So integrative medicine is used with two meanings. One is, it is referred to integration of CAM and mainstream medicine. And the second one is to put the patient at the center and address the full range of physical, emotional, mental, social, spiritual, and environmental influences that can affect a person's health. And I believe that the traditional medicine holistic approach represents both of these two viewpoints. So not only it covers the first one, but also it covers the second one, because in the concept of temperament, we are actually working at all these different levels. And here I want to end this presentation with this beautiful figure from the Osher Center of Complementary and Alternative Medicine that it says we view integrative medicine as more than some of conventional and alternative medicine, but also as a path to deeper understanding of basic physiology, health, and disease that underlies both. So a current limitation that we have in our today's conventional medicine is its organization into separate physiological systems and fragmented approach to therapies. And the integrative view of health is something holistic that can emphasize the interconnection between mind and body across physiological systems. So I hope that this presentation was something to give you some ideas about this theory of hot and cold as one of the fundamental concepts in traditional medicine. The book that I talked about is named Hot and Cold Theory, The Path Towards Personalized Medicine. You can find it through the Springer's website or through the Amazon. And yeah, I will be happy to, if you have any question, Dr. Govan, I'm sharing I'm stopping sharing my screen and I'm with you.
All right. Thank you so much, Dr. Yavari. That was an amazing presentation. I know that in the dedication of your book that you edited, you said that this was information was for those who would think critically and develop this idea more in the future. And I certainly know, listening to your talk today, I think about how these concepts can be applied to concerns of health and concerns of illness. And I find it so valuable, and I know others will as well, to hear expressions of ideas using different terms, using different language, using different information from other cultures. It's really critical for our understanding of our own health and well-being, but also how to help others. And you did a tremendous job of doing that. So I'm very grateful. And on behalf of the INCAM Research Network, I want to thank you for your time and your effort today. We are very grateful.
You are very welcome. It was my pleasure.
Terrific. Thanks so much. We'll end here for today, and we'll look forward to opportunity for more dialogue and exchange in the future. And thank you again.
Thank you. Have a nice day.
Thank you. You as well.